My name is Rocco Barazzoni. I work in the University of Trieste, Italy, and I will talk to you about obesity and its major metabolic complications. We know that we are facing an obesity epidemic throughout the world, and this has become a major clinical and socioeconomic challenge because of its heavy and pervasive metabolic and cardiovascular complications, as well as many other diseases that are associated with obesity, of course. But alterations in glucose and lipid metabolism really play a major role in the pathogenesis of insulin resistance that can lead to diabetes and in turn to major risk for cardiovascular disease. Insulin resistance actually is one of the key, if not the driving force behind the alterations that we can summarize in the metabolic syndrome definition. That is higher blood glucose, increased triglycerides, lower HDL cholesterol, high blood pressure, and last but not least, an increase in waist circumference that is a key marker of abdominal obesity. And we know that when fat accumulates not only anywhere in the body, but in the abdomen, in the visceral compartment, then you have the higher chance of having metabolic complications. And this enlarges the spectrum of patients at risk also to overweight patients that do not even reach the threshold for obesity, but have abdominal accumulation of excess fat. We need 3 out of 5 of the above alterations to have the diagnosis of metabolic syndrome. And metabolic syndrome is a disease that is very pervasive in our society. It reaches up to 25 and even more % as a prevalence, and in the higher decades of life, in the elderly population, it becomes even more, 40 or 50%. We, as a nutritionist, have a major role, I think, in treating and preventing these very harmful and challenging diseases. We really need to focus on the quantity and quality of food. We can do that with the general diet of the patient that needs to be really focused on the quality of the fat and the carbohydrates. Reduction is, of course, the key first tool to achieve the negative energy balance. But also there is certainly room for a clinical nutrition approach using nutrition supplements that may improve the intake of antioxidants and anti-inflammatory nutrients that may potentially improve the insulin resistance that is at the basis of the disease. So I encourage you and I hope that you will take advantage of ESPEN educational tools, including LLL courses, to really focus and learn more about this important and challenging nutritional alteration, condition, and disease. Thank you for your attention.